Welcome to the Medtronic Learning Series. This is the Cervical Spine Anatomy module. To understand your neck and its health, we have to understand the cervical spine, the main support structure for your head and neck. Your spine gives you the support you need to hold yourself upright. The spine also protects the spinal cord and nerves. The spine is composed of 33 bones, called vertebrae, with spongy discs in between each vertebrae. There are four main sections of the spine. The cervical section has 7 vertebrae and supports your neck and skull. The thoracic section has 12 vertebrae and supports your shoulders and rib cage. The lumbar section has 5 vertebrae and supports the lower back. The sacrum and coccyx section has 9 fused vertebrae and supports the pelvis. The cervical section has 7 vertebrae, labeled C1 to C7, which support your skull and neck. The base of the skull is called the occiput. The cervical vertebrae are smaller in size compared to the other spinal vertebrae. The top 2 vertebrae, C1 and C2, are often called the atlas and axis. C1, or the atlas, is a bony ring, with 2 flat spaces where the skull sits. The atlas sits on top of the C2, or the axis. The axis has a peg, called the odontoid process, that protrudes upward into the ring of the atlas. This creates a pivot joint that allows rotation of the head and neck. The vertebrae from C3 to C7 are similar in appearance and features. The vertebral body is the bony structure located in the front of the cervical spine. The vertebral bodies in the cervical spine curve upward to form uncinate processes, which provide some stability. On the left and right side of each vertebral body is a ring of bone called the transverse foramen. The vertebral arteries ascend through the transverse foramen of C6 to C1 and enter the skull. The vertebral foramina is the hole that allows nerves to exit the spine and go to the arms. The lamina is the area of bone that covers the spinal canal. The inferior and superior articular processes overlap each other to form a facet joint. The spinous process is the part you can feel through the skin at the back of your neck. The C7 has a very long spinous process that can be felt just above your shoulders. The pedicles join the lamina and processes to the vertebral body, enclosing the spinal cord. The spinal cord extends from the brain. The spinal cord exits the base of the skull through a hole called the foramen magnum, continuing through the bony ring of the atlas and axis. Eight pairs of spinal nerves emerge from the spinal cord and exit the cervical spine between vertebrae from above C1 to below C7. These nerves go out to the arms and hands. In between the vertebrae are spongy discs, called intervertebral discs. These discs play a vital role in the spine, acting as shock absorbers. If you could see the disc, which you can't on an X-ray, it would look like this. It has an outer layer called the annulus, which is a ring-like structure that encompasses the nucleus. In a perfectly normal disc, it is difficult to injure the disc without injuring the vertebrae first. This is because the disc is mostly water.